Curt Sigmund, Chair of the Council on Hypertension. I'm joined by Daichi Shimbo, Vice Chair for Clinical Programs, Dr. Brandi Wynne, Chair of the Trainee Advocacy Committee, and Dr. Cam McCarthy, Vice Chair of the Trainee Advocacy Committee. Another hypertension scientific session has concluded. We have 3 full days of presentations by our award winners, trainees, and early career stage investigators. Our conference started with our keynote lecture from Dr. Gregg Semenza, recipient of the 2019 Nobel Prize in Physiology or Medicine, and was highlighted by 3 recipients of the Excellence Award in Hypertension Research. We also enjoyed some interesting live network sessions where we met with Dr. Semenza, asked questions of our expert panel on single-cell genomics, had an early career roundtable and clinical cases sponsored by our journal Hypertension, learned about funding and grant opportunities from the NIH and American Heart Association, and had an opportunity to participate in the CHAMP session. Dr. McCarthy, can you tell us a little bit about CHAMP?
Thank you, Dr. Sigmund. This year, CHAMP was a little different from past years due to virtual programming, but we were still provided 2 important sessions for trainees. This included a track on how young and established scientists successfully navigated the COVID-19 pandemic, as well as a track on non-academic career options for hypertension scientists. I would like to acknowledge the help of Drs. Bruder, Yang, Kumarasamy, and Golosova for their organization, and all the panelists for their participation. Post-meeting, we are hoping to relaunch the mentee-mentor matching into a year-long rolling enrollment that will allow trainee scientists to register and participate in CHAMP on a continuous basis.
Dr. Wynne, as you know, we dedicated over a third of the oral program to trainees and early career investigators. Can you speak to the impact this conference has on career of these young scientists?
Yes, absolutely, Dr. Sigmund. I know that this has been crucial for researchers, for early career researchers in the council. It's really been a tough couple of years for everyone, but I think we can all agree it's been especially difficult for trainees just starting out to early career faculty trying to get up and running. Having this spotlight on our work and highlighting all they have been able to accomplish is so important, not only for morale, but for future grant and award applications, networking, and feedback on their research programs. Side note, we are also really grateful that you and the council recognizes this is such an issue, and we know that everyone wants to get back to in-person meetings, and we hope that this strong focus on early career work will help all new investigators in the council.
Dr. Shimbo, what were some of the most exciting moments from the clinical science clinical practice session?
First of all, I just wanted to highlight, we took a slightly different approach this year. Most of our sessions actually were very interactive, rather than the usual talks that are given and a little bit of a panel. A lot of our sessions actually were directly interactive. Most of the time actually was spent with the experts and talking about specific topics. Now, not to diminish all the topics, but there are 2 I'd like to highlight, my favorite 2. One was managing blood pressure beyond the physician room. You know, obviously we're now in 2021, we're in the middle of the COVID pandemic, and there was just such a focus of this session on for improved blood pressure control outside of the office, because of course it's very difficult for patients to actually enter the office for clinical diagnosis and management. So there was a focus on lifestyle interventions by Dr. Larry Apple, the role of social support by Phil Levy, and then the role of home blood pressure monitoring by Catherine Tucker. She also focused on pregnant women as well. I thought that was fantastic. The other session I want to highlight is the equity and hypertension control. Obviously, blood pressure control rates have been getting worse in the United States. And for me, this is an all hands on deck emergency moment. We all have to get the clinicians, communities, and then really our health policy organizations together. And there was a great discussion moderated by Vali Fontil, along with Dr. Commodore Mensah, Dr. Ibe, Dr. Jafar, who sort of gave the global international perspective, along with Keith Ferdinand. And I really thought that was it was a completely interactive session. And I thought that was extremely valuable for our audience members.
So for everybody watching, remember you have 90 days to return to the conference portal to rewatch your favorite presentations or to catch up on all the content you missed. We hope to see you all for Hypertension Sessions 2022, which I am happy to say will be live September 7 through 10 in San Diego, California. See you then.